Hey, this is Amy Taylor with a very, very special edition of Healthy, Fit, and Strong for Bethel Park TV. We are here at the Central Outreach Wellness Center on the North Shore, where they provide testing and services for the LGBTQIA plus community. They do testing for STIs, HIV, Hep C, they do PrEP, and most importantly, they provide a cure for Hep C. They service more people here for Hep C than any other provider across the country. They'll also provide medication to you on your doorstep within 2 weeks of you being seen here or calling in. The service that they do here is phenomenal. They give back to the community. They provide a service that is so invaluable to the LGBTQIA plus community. And I really, really want to highlight that today and talk to some of the people inside about the work that they do. Why don't you come along with me and we can talk to them together? As you can see, the welcome mats are rainbows, welcoming all into their center. All are welcome here. Let's walk around the corner. What a beautiful day it is here in Pittsburgh. And I want to show you the bike racks. Rainbow. People ride their bikes here to work. And as you can tell, they have their own pharmacy, the North Shore Health Mart Pharmacy, caring about you and about the real you, sending a positive message forward. Now here we have the main doors, and we're going to go in and we're going to talk to some people inside. We're here with Dr. Stacy Lane. What a privilege it is. Thank you for making time for us today. She is the founder of this center. Tell us what brought you back here to Pittsburgh and the work that you do here.
I had worked at a queer organization at AGH and had seen problems with racism. And it didn't make sense to me that LGBT people sometimes discriminated against people of color, for example. In my brain, human rights are human rights, right? We all should be treated the same. And then I had the experience of working for an FQHC that was primarily African American and people of color, but they were homophobic. And I worked for them for about 3 years as part of a contract to pay back my student loans. And it became difficult to work there because they didn't want to be known as an HIV clinic. They were still concerned about the stigma of bringing HIV positive people or LGBT people into the space that was also shared with a pediatrician and some other doctors. So through all of this, it sort of became profoundly obvious that like if I was going to do this, I was just going to have to do it on my own. But anyway, so I ended up writing this email in the middle of the night to God and everybody, I always say. But I wrote this big long email that I timestamped at 5 in the morning on Black Friday before I went out to shop. And I sent it to everybody that I could find, from the State Department of Health, the CDC, HIV folks, STD folks, etc. And I said, you know, this is who I am. I'm this doctor from Pittsburgh. I have, you know, I want to say it was like 200 transgender patients that I'm caring for, many of them HIV positive, that don't fit into the healthcare system that I've been caring for at the county health department, and then some of these FQHCs, and now I've been told that we're not welcome here either, and I'm going to be leaving here. And I wanted them to know two things: that one, there was this gap in healthcare, that these people needed care and I didn't have anywhere to send them, but also that I was kind of clearing my conscience to know that, like, I tried everything. I can sleep at night knowing I tried everything. And it was actually interesting, and one of the moments of my life I'll never forget is that I sent this email and I thought that, as most times in my career, some administrator would look at it and go, oh, she's nuts. You know, she's delete. And lo and behold, I ended up getting an email back a couple of weeks later that that actually invited me to a Google call, and Google calls were brand new, but I knew it was a bunch of important people on there because they were government emails. So I spit out in that phone conversation the same the same thing that I wrote in the email to them, and basically said, this is who I am, this is what I want to do. I just need a grant to do it, to get it started. I know how to do this work. I know how to make it work financially if you just give me a really small grant. And here we are, 5 years later. I had the phone call, I hung up the phone. One of the guys on the phone called me right back, and he said, don't do anything, don't make any decisions, we're gonna get you funded. And I remember I cried that night, and for me, obviously it's a dream come true to be able to provide health care in the way people need it, without all the problems with bureaucratic crap, with rules that don't make sense, with gatekeeping policies, and things that stand in the way that are unnecessary for people to get good health care. We can provide care to people regardless of their ability to pay. If they don't have insurance, we help them get it. We see them for free until they get taken care of. We provide PrEP, which is an HIV prevention modality, which back in 2015 when we started, most people were not for. They were concerned that taking PrEP would prevent HIV, but not any other STDs. So they were concerned that it would drive the STD rates up otherwise, even though it was preventing HIV. And so there was some fighting going on in the medical community as to whether or not PrEP was a good idea. Now the CDC has endorsed it, and lots of things now 5 years later. But there was a time where we were the only one that was doing it in town, and we took a lot of heat for it. And TransCare is somewhat similar. That we were doing TransCare when we first started. I've been doing TransCare since insurance companies wouldn't pay for the medications, and the women had to pay out of pocket, or we found a way to get them for pennies on the dollar through pharmacy relationships and pharmacy programs over the years. But under the idea that getting them from us, from a harm reduction standpoint, is better than you buying them off the streets and getting God knows what, and no one's monitoring and no one's educating you about things. So doing healthcare that basically no one else was willing to do early on has really what we've been building our practice on, caring for people that no one else wanted to care for. We've now expanded that here to the addiction population as well. We treat them for Hep C. There's lots of gatekeeping things that happen in the addiction community for them to be able to get their Hep C treated with a liver specialist, for example. Liver specialists are very hard to come by. Liver specialists, GI doctors make their money and their profits on scoping, so they're not really interested in dealing with the Hep C. It's not a big part of their practice for many of them, and it's no judgment, but for them it's not financially feasible to do that kind of work when you can make more money and your practice is more successful with procedures. So we've sort of created a stopgap there for the Hep C addiction community by treating their Hep C for them and making it as low barrier as possible, where we take the medication to them, get it delivered to them, where we meet them where they are. Sometimes we go to the addiction programs directly, do the healthcare on site there with the patient, draw their blood at the addiction programs when we first diagnose them, even making it so they don't have to actually even come to our office. This is especially important for Western Pennsylvania, where there's so many rural communities, limited transportation, COVID, all of these things that are burdens to people and make it difficult for people to get health care at Pittsburgh. Especially when you have a history of addiction and your life may not be totally where it needs to be and together yet. You're still struggling financially, you're still struggling with your sobriety, etc. So, but that's really what this whole place is built on, is caring for people that the medical system sort of has left behind and doesn't put any time or energy or effort into really treating.
We're here inside of the center. How exciting. And you see this beautiful mural. Got the Hep C, get the cure. Isn't that the truth? #1 in the United States. And we're going to go upstairs and we're going to talk to Alex. He's the director of marketing. Good morning, Alex. How are you today?
Hello, how are you? I'm good.
Very, very fine. We're delighted to speak with you today about the work that you do at the center.
Yes, so we are at Central Outreach Wellness Center, North Shore. This is our headquarters.
And what is the work that you do here in this office?
In this office, this is our hepatitis C office. This is our Hep C war room, as we like to call it. So this is essentially the hub where the Hep C Cure Squad, as appears on my t-shirt, comes and does our work. We are the number one cures of hepatitis C with the medication called Mavorite, which is the most popular type of medication that cures Hep C in 8 weeks or 12 weeks.
That's amazing. That's absolutely amazing. And I want the viewers at home to actually seep that information in. They have a cure. They have a cure right here. So if you're suffering from that or you know someone who is, send them here to get the cure.
Absolutely. It's a very convenient process. We can test you at home. We can test you at the clinic that you go to if you don't come to Central Outreach. And we can have medication delivered to your doorstep in as soon as 2 weeks.
So you actually go to people's home to treat them?
We do, yeah. We can schedule house calls if you have difficulty traveling. And if you just need us to come to your home for any other convenient reason, we'll meet you there for sure.
That's amazing. And you do the Hep C testing for the cure here?
We can test you for hepatitis C here or any Central Outreach location, but we find that our patients are most often at Suboxone or methadone clinics or addiction recovery centers. So we're going to a lot of rehabilitation centers or clinics of the methadone and Suboxone nature. We're traveling really anywhere. Wherever you have hepatitis C or think you have hepatitis C, we'll follow you and test you and cure you.
That's incredible. And I think it's important to know that you actually deliver the medications to people's doorstep right in their own home.
Yes, like I said, if you have difficulty traveling, the medication can be delivered by mail to your door. So it's a very convenient process for you.
Wonderful. And you also give back to the community in ways of food and meals, correct?
Yes, that's true. Every Wednesday we get pre-prepared meals here for patients suffering food insecurities. We also have fresh produce and fruit that gets delivered here every week for anybody who needs food.
How wonderful. How wonderful. Thank you very much.
So this is the hepatitis C rapid test. Looks like this. When you open it, there is something that looks like sort of like a pregnancy test, which enables us to give hepatitis C results in 10 minutes or shorter. So it works with a finger stick. You prick somebody's finger, a drop of blood gets on this little white piece right here. Then the white piece you dip into this, and then you get either 1 bar for a negative or 2 bars for a positive, and that's your Hep C rapid test. And this is how we determine if somebody has hepatitis C. If they do, we'll draw their blood. Once we get the blood work back, then we can have the medication shipped to your door. If you're negative, obviously you're good to go.
And how many people would you say in Pittsburgh, Allegheny County, or across the globe have Hep C?
That's a harder number to come across, but I can tell you that we have tested in Pennsylvania alone over 6,000 people and cured over 2,000 people of hepatitis C, and our work is not even close to being done in Pennsylvania alone.
Wow, wow, that's amazing. Thank you for the work that you do.
Absolutely.
So how would somebody know if they need to be tested or not? Are there symptoms that they show?
So the symptoms for hepatitis C are lethargy. Honestly, most of the time when we're in the field, people say that they're getting really tired, that they feel fatigued, they're lethargic. And so whenever you feel that most oftentimes is the hepatitis C working in your body, the viral load working in your body. The viral load is specifically how many copies of hepatitis C are in your body. Another symptom of hepatitis C is itchy skin, which is rare, but sometimes. Also jaundice, which is yellowing of the skin, which often happens when you have liver disease. So it's important to figure out what is going on with your liver, whether it's hepatitis C or cirrhosis or what have you. And lastly, people often say that their urine becomes very brown or just a dark yellow color and very smelly. So if that's happening to you, then that also could be hepatitis C as well.
Interesting. And didn't Pamela Anderson also have Hep C?
That's surprising to me. News here. I'm not sure about that, but yes, maybe.
Yes, and I believe she was cured as well. So perhaps that she was cured with the same medicine that you guys are administering.
That's very possible if she was cured. Back in the day, 10 years ago, hepatitis C treatment was very different. You were treated with something called interferon, which was more closely aligned to chemotherapy. And so people with hepatitis C didn't want to take interferon treatments because they would lose their hair, they would have severe nausea, and the treatment was just honestly very painful and not convenient and not comfortable, so people wouldn't get treated for hepatitis C. with modern medication and technology, we now have 4 different types of hepatitis C medication. Obviously, I said that Mavyret is the most popular, but there's also Harvoni, Epclusa. There's another one, but Mavyret, Harvoni, and Epclusa are the 3 types of hepatitis C medication now that are just pills and less invasive than interferon.
Yeah. Well, it would have been about 10 years ago that she would have had it and been cured of it. And I see you're going to give me a Hep C test today. All right, and we're going to show the people at home exactly how easy it is to get tested.
So this is the hepatitis C rapid test, and this is something that we perform on individuals in the field at clinics or in their house, wherever they need us.
Just a drop of blood, right?
Just a speck of blood. You get your results back in 10 minutes.
So before this interview is even done, we're going to find out my results on camera. Let me know when you're ready to start.
So here I'm going to loop your blood into this small little loop that we have here. The loop goes into this solution. Important to get the blood off the finger just in case you are positive. You don't want to contaminate any surfaces that are around you because blood can be very minuscule, very small to transfer hepatitis C. It doesn't need to be visible.
Interesting.
So this result will come back in 10 minutes,
We'll check back.
and I will get you a Band-Aid.
And let me just tell the people at home I felt absolutely nothing. Like if I went like this, that's basically what it felt like. I mean, it was so easy to do. If you are experiencing these symptoms at home, please do not hesitate to call the center who can come to your home, or you can come down here and very easily be tested just like I was today. No rainbow Band-Aid?
Those are downstairs.
Thank you very much.
Of course.
And we try to provide medical care for people, and we try to listen to people and listen to their needs, and meet them what they are and help them fulfill their goals, and really be patient-centered, where the patients are the center of the space, the center of the process, not the system or the doctors, etc.
We're here with Shantae. I happened to meet her before she went into work, and we're going to have a little discussion about the work that she does inside. Good morning.
Good morning.
Yes. Can you tell us a little bit about the work that you do?
So I'm a medical assistant here, and basically it's the responsibility of a medical assistant. Like, we're the first people that patients see. We take them into a room, do vitals, blood work, and things like that, and then we let the doctors come see them and take it from there.
Do you enjoy the work that you do here?
I love it. I love working with my community. I love working with the people in here. It's a phenomenal atmosphere. Everybody in here is awesome. So
Do you find it rewarding in your heart to help these people?
knowing that I'm giving back to my community, yes.
And that's what's most important. Thank you, Shantae, today for chatting with us and for the work that you do with the program.
Thank you.
We have with us here today Tinky, and Tinky's a worker inside. Good morning, Tinky.
Hi, good morning.
Can you talk to us a little bit about the work that you do inside?
Yes, I'm actually a medical assistant and a phlebotomist there. I actually do the blood work and people's vitals, and I take care of them and make sure they have food, water, and clothing.
And how long have you been working here?
I've been working here for about 4 years.
4 years. That's amazing. Do you enjoy the work that you do here?
I do. I love it. I love the work that I do.
You love doing with the blood and everything?
Yes, I love just taking care of people and making sure they have what they need.
That's wonderful. And the people that you come in contact with, I'm sure that they appreciate your services and love you for all that you do.
Thank you. I appreciate it.
Thank you for speaking with us today.
Thank you. Have a good one.
We're here with Harry. He's the lab director here at Central Outreach. And we're going to talk to him about the work that you do. Good morning.
Good morning. The MAs will take blood, bring it back to us. We then put them in our centrifuges, and we need to balance them out. And if this was blood, then we just balanced it out across from one another. We shut the lid, and then we hit start, and it will spin down for 15 minutes. And once it's done, then we take it out, we put it in a bag, and then we process it on the computer, and then we send it out to Quest. Now, if it's a state sheet, these are our state sheets, and they get sent out to the state, which is the down in Texas is where the lab is for them.
Interesting.
And this is something that is free for the patients. Anyone can come in and get an STI screen, whether you're LGBT or not. We don't turn away anyone for a screening for HIV, syphilis, gonorrhea, chlamydia. So they can do an oral swab, urine, blood work, and that's all through the state. It's free to anyone that wants to come in. It's just processed differently. It doesn't go to Quest. It gets sent out in a box to the lab down in Texas.
Is there anything that you need to report to the state upon your findings?
No, they actually report to us. They send us, like if somebody is positive for HIV, they will send that to us, and then we have to report it to Allegheny County Health Department.
What about the work that you're doing currently with COVID-19?
COVID-19, we do, like if it's our patient and they ask for us to
Right.
do a sample, we have samples. This is our nasal swab.
Ready to open this or no?
Yeah, you're free to open it.
Okay.
And it goes, the tube goes up in the nose. It does make you cry. And then we send that out to Quest as well. We also have the throat ones.
How long do you have to swab the nasal cavity?
To the count of 4.
1, 2, 3, 4, way up in there till you start to cry,
Right.
and then you're done.
And
You put that
right.
in there, and then you send it off to Quest.
Correct. And it has to be refrigerated.
Oh, interesting.
And these are the throat ones as well as the nasal ones.
Also COVID-19?
Also COVID-19, and they are the same process, whether it's down the throat or up the nose. It can be both. And they are also refrigerated and sent off to Quest.
And what's the turnaround time to get results for COVID?
Right now, the turnaround time is about 7 days.
That's not bad.
When it's not so hyped, we can get them back in 3 days.
Okay. Yeah.
It just depends on how many tests they're running.
So the only time that you test people is when they come to you with a concern.
Or call us, and
Right.
we have people that have symptoms that call us because we'd rather just go to the car than them coming in and contaminating.
Right. Interesting. But not to the home?
We have went to people's home
Okay.
and done tests. If they,
Interesting.
we
Is that only for your patients or is that for anyone?
normally it's our patients that call us,
Right.
but if we have an outsider, like say a police officer or anyone that wants it and they're unable to make it to us,
Right.
we can go to them.
Okay. Because we want to get the word out to people that the services are here and they're available for everyone.
Right. We are LGBTQ related, but for STI screenings, if they need COVID-19, we have done so many. We went to Pittsburgh Zoo and had done them. We also are going with Allegheny County Health Department and the state, and we are going to be doing those in the near future. And they are free.
Yes.
And
All your services are free, correct?
correct.
Yep.
We never charge a copay.
If you have insurance, it is welcome. If you
Right.
don't have insurance, it's not necessary. That's
Right.
right. So I don't want anybody to feel that they cannot come in for treatment because they'll treat anyone and everyone here.
Correct.
No one's ever turned away, correct?
No one is ever
Yes.
turned
And
away.
that's an important message to get across.
And that's Dr. Lane's mission is to provide health care to everyone, whether you can afford it or not. We are going to go out in the community and do testing for COVID-19. We are planning on going out on Tuesdays and Thursdays really soon. And then we will go wherever we're set up and do it for like 4 hours and then come back. They'll give it all to me, and then we'll have the state pick it up, or Allegheny County Health Department, whatever lab they have that they use, will pick them all up from us and take them.
So we're here in the community room at Central Outreach. And the community room is welcome to all. This is where the staff comes to relax, to congregate, to have staff meetings. And this is also where the public is welcome to come in as well. Talk a little bit about that.
That's correct. This is our community space at Central Outreach Wellness Center. Oftentimes, we have people who are homeless or people who just need various different resources, and this is a place where we can serve them those resources or get them a meal if they need that, or they can sit on one of the various couches and take a nap, take a load off if they need to do that as well. If they need clothing, per se, if they are going through gender transformation and they need male clothes or female clothes they didn't already have, they can come here and take some of those clothes for free of charge, no problem, no questions asked. So this is a space where we facilitate a lot of our community endeavors. We have an art therapy, we have Crystal Meth Anonymous, we have various resources and systems and programs in place to help people, and this is where we do that.
Okay, and talk about some of the clothes here.
So these are clothes that we have for people who identify as male or for people who identify as female. If you're going through the gender transformation process, we have whatever type of clothes that you might need at the time.
Thank you so much for the work that you do here today. Can the viewers at home do anything to give back to your center to help out the people in their community through your outreach programs?
So we have a nonprofit called the Hugh Lane Foundation. That's our sort of nonprofit arm of the practice. Hugh Lane Foundation recently has been involved in food deliveries to people of the LGBT community and others during the coronavirus pandemic. They also do advocacy work around youth, and they are a 501(c)(3), and a charitable contribution can be sent to them to help the work that we do. There's also other organizations in town, specifically people like True Tea, which is also another nonprofit, the Love Diamond Project, and Trans United, all organizations that we're currently incubating from Hugh Lane. Through this incubation process, we're trying to help them build infrastructure. These organizations are focused on the most marginalized of our community right now, which is the intersection of queer people and people of color who experience both racism and homophobia, which really gets in the way in their lives and makes it hard to be successful. So we're creating programs to through the nonprofit and the foundation and these three nonprofits that we're incubating right now. We're creating infrastructure for them and helping them on their mission. One of which specifically is to create housing for trans people of color. That's True Tea. The second one is Trans United, which is in the process of getting a food truck that's going to create jobs for women of color, trans women of color, and get them trained with safe serve and meaningful career path in a comfortable environment where it's okay to be transgender. And then the Love Diamond Project as well, who's also working on some advocacy things. So any donations can be sent to the Hugh Lane Foundation. They'll likely be supporting one of those three organizations that we're currently incubating.
Thank you so much for the work that you do here for one and for all. And I think you said it best, if I may use your words. You didn't fit the mold, but that's okay. Because if you at home don't fit the mold, it's okay. Just be you. Be true to who you are. Speaking here from the Central Outreach, thank you, Dr. Stacy Lane. We're back with Alex as far as my Hep C results. Alex, what does it say?
So your hepatitis C result is negative. 1 bar means negative. 2 bars, which you do not have here, would be positive. And fortunately for you, you're negative.
Thank you so much for everything today.